For decades, millions of women were told the same thing. Hormone therapy for menopause causes breast cancer. End of story. Doctors refused to prescribe it. Women who asked were dismissed or told to just push through the hot flashes, the sleepless nights, the brain fog, the weight gain. And if they did get a prescription, many never filled it, because right there on the label was a black box warning, the most serious alert the FDA can put on a medication, listing terrifying risks in bold letters. Now, in November 2024, the FDA itself is removing that black box warning from more than 20 hormone therapy drugs, and the agency's own commissioner is calling what happened over the last 2 decades an American tragedy for women's health. If you're a woman over 40, or you know one, which is pretty much everyone, this is information you need to understand. Because this isn't just about correcting a label. It's about 23 years of fear, misinformation, and millions of women denied access to a treatment that could have changed their lives. Here's what most people don't know. The study that created all this fear, the Women's Health Initiative from 2002, was misunderstood from the start. The headlines screamed that hormone therapy causes breast cancer, but when doctors actually read the published data, the increase in breast cancer wasn't even statistically significant. And in the years since, no clinical trial has ever shown that hormone therapy increases the risk of dying from breast cancer. But the damage was done. The fear machine was already running, and it's been running for more than 2 decades. Before 2002, about 1 in 4 women used hormone therapy to manage menopause symptoms. Today, it's closer to 1 in 20. That's an 80% drop. And it's not because women stopped having symptoms. It's because a single study, reported in a sensational way, convinced an entire generation of doctors and patients that hormones were dangerous. Period. No nuance, no context, just fear. If you're in your 40s, 50s, or 60s right now, and you've been struggling with menopause symptoms, this matters to you. Hot flashes that wake you up drenched in sweat, brain fog so thick you forget words mid-sentence, weight that piles on no matter what you do, mood swings that make you feel like a stranger in your own body, pain during sex that makes intimacy feel impossible. And when you finally work up the courage to ask your doctor for help, you're told to just deal with it, or you're handed an antidepressant, or you're given such a low dose of hormones for such a short time that it barely touches the symptoms. Here's our take. This isn't just a medical story. It's a story about how fear, bad communication, and groupthink in medicine can harm people on a massive scale. It's about how women's health issues have been historically ignored in medical education. And it's about how we, as a society, are finally starting to have an honest conversation about menopause, one that doesn't treat it like something shameful or trivial, but as a major life transition that deserves real, evidence-based care. This video isn't going to tell you to start or stop any medication. That's between you and your doctor, but it will give you the information you need to have a much better conversation with your healthcare provider. Because the truth is, for many women, hormone therapy can be life-changing. Not a miracle cure, but a tool that, when used correctly, in the right person, at the right time, can relieve symptoms, protect bone health, and possibly reduce risks of heart disease and cognitive decline. And for the last 23 years, most women haven't even been given the chance to consider it.
What really happened in 2002? What does the science actually say now? Who are good candidates for hormone therapy and who should avoid it? And most importantly, what does this FDA decision mean for you if you're navigating perimenopause or menopause right now? To understand why the FDA is making this change now, we need to go back to 2002 and look at what actually happened with the Women's Health Initiative study. This was a massive research project funded by the National Institutes of Health, designed to answer big questions about hormone therapy, diet, and women's health. The hormone therapy part of the study enrolled over 16,000 women, and it was supposed to run for years. But in July 2002, the study was stopped early because researchers saw what they believed were concerning safety signals. Here's where things went wrong. Before the study was even published in a medical journal, where doctors could read the details and analyze the data, the findings were announced at a press conference. And the message that went out to the world was simple and terrifying. Hormone therapy increases the risk of breast cancer, heart attacks, and strokes. The media ran with it, headlines everywhere. Women panicked. Doctors stopped prescribing. And within months, the use of hormone therapy dropped off a cliff. But when the actual study was published weeks later, and doctors who knew how to read medical research looked closely at the numbers, they saw something very different. The increase in breast cancer risk. In fact, some researchers involved in the study tried to speak up at the time, saying, "Wait a minute, we can't put this information out there like this, because once you study millions of women with the words breast cancer, you may never be able to correct the record." And that's exactly what happened. What often gets overlooked is that the Women's Health Initiative wasn't studying all women, or all types of hormone therapy, or all ages. The average age of the women in the study was 63. Many of them were more than 10 years past menopause when they started the hormones. And the specific combination they were given was oral estrogen, plus a synthetic progestin, not the only form of hormone therapy available, and not necessarily the form that would be prescribed today. But none of that nuance made it into the headlines. The message was just, hormones equal cancer, stay away. In the years since, researchers have gone back and reanalyzed the Women's Health Initiative data over and over. And here's what we know now. For women who took estrogen alone, meaning women who had had a hysterectomy and didn't need progesterone, there was actually a suggestion of lower breast cancer risk, not higher. For women who took the combination of estrogen and progestin, there was a small increase in breast cancer incidence, but importantly, no increase in breast cancer mortality. Meaning, yes, slightly more cases were diagnosed, but women weren't dying from it at higher rates. And when you look at other outcomes, like bone fractures, the benefits were clear and significant. Here's the real kicker. The study also showed that timing matters enormously. Women who started hormone therapy within 10 years of menopause or before age 60 had different outcomes than women who started it much later. In the younger group, there were signs of cardiovascular benefit, not harm. But that finding got buried under the fear. For more than 2 decades, we've been acting as if all hormone therapy for all women at any age is dangerous, and that groupthink has done enormous damage. Our view here is that this is a textbook example of how medical science can be distorted by the way it's communicated. It's not that the Women's Health Initiative was a bad study. It provided valuable data. But the way that data was released, interpreted, and reported created a panic that overrode scientific nuance. And once that fear took hold, it became almost impossible to dislodge. Doctors stopped learning about menopause in medical school.
Pharmaceutical companies stopped developing new hormone formulations, and women suffered in silence, told that their symptoms were just something they had to live with. Have you ever felt dismissed by a doctor when you brought up symptoms that were seriously affecting your quality of life? That's what's been happening to millions of women for over 20 years. And it's not because doctors are uncaring. It's because they were taught, incorrectly, that hormone therapy is too dangerous to consider for most patients. The FDA's black box warning reinforced that message every single day. Every time a woman picked up a prescription and saw that warning label, 30% of them, according to one analysis, decided not to take the medication, even though their doctor had prescribed it. So why is the FDA acting now? Because the weight of evidence has shifted. Major medical organizations, including the North American Menopause Society, have updated their guidelines to reflect what the science actually shows. Hormone therapy, when started at the right time, in the right women, with appropriate counseling and follow-up, has a favorable risk-benefit profile. It's not risk-free, nothing in medicine is, But for women in their 40s and 50s with significant menopause symptoms, the benefits often outweigh the risks. And the FDA has finally acknowledged that the black box warning was creating more harm than good by preventing women and their doctors from having informed, individualized conversations. So let's get to what you actually need to know. Who benefits from hormone therapy? Who should avoid it? And what does this window of opportunity everyone keeps talking about actually mean? Because this is where the conversation needs to get specific and practical, not just theoretical. First, let's talk about the benefits that are well established. Hormone therapy is incredibly effective at relieving the classic symptoms of menopause: hot flashes, night sweats, sleep disruption, vaginal dryness, pain during sex, mood changes. For many women, these symptoms aren't just uncomfortable, they're debilitating. Imagine waking up 5 times a night drenched in sweat, unable to get back to sleep, then dragging yourself through work the next day in a fog, or avoiding intimacy with your partner because it's become painful and embarrassing, or feeling like your brain just doesn't work the way it used to, forgetting names, losing your train of thought mid-sentence. Hormone therapy can address these symptoms in a way that nothing else really can. Beyond symptom relief, there are longer-term benefits that matter for health span, especially bone health. Estrogen plays a critical role in maintaining bone density. After menopause, when estrogen levels drop, bone loss accelerates and the risk of fractures goes up significantly. 1 in 3 women who make it to age 80 will have a hip fracture, and the 1-year mortality rate after a hip fracture is 20%, even with surgery. Hormone therapy can preserve bone density and reduce fracture risk, which for many women is a meaningful benefit that extends far beyond just feeling better day to day. There's also emerging evidence, though not yet definitive, that starting hormone therapy early in menopause may have cardiovascular and cognitive benefits. Some studies suggest a reduced risk of heart disease in women who start therapy within that critical window, and there's data showing lower rates of cognitive decline and possibly Alzheimer's disease in women who used hormone therapy around the time of menopause. Now, we need to be careful here. This doesn't mean hormone therapy is a proven treatment to prevent dementia, but it does suggest that estrogen may play a protective role in brain health, and that abruptly losing it at menopause could have consequences we're only beginning to understand. Here's the key concept: the window of opportunity. This is the idea that hormone therapy has the most favorable risk-benefit profile when started within 10 years of menopause or before age 60. During this window, the body is still relatively accustomed to estrogen. Blood vessels are healthier,
Tissues are more responsive, and the benefits in terms of symptom relief and possibly long-term health outweigh the risks for most women who don't have specific contraindications. But outside that window, the picture changes. If you're more than 10 years past menopause or over age 60, and you've never taken hormone therapy before, starting it for the first time carries different risks. The cardiovascular risks, including blood clots and stroke, become more concerning. This doesn't mean it's never appropriate, but it means the conversation with your doctor needs to be much more careful, weighing your individual health history, risk factors, and what you're hoping to achieve. Now let's talk about who should not use hormone therapy or who needs to be very cautious. If you have a personal history of breast cancer, particularly hormone receptor-positive breast cancer, systemic hormone therapy is generally not recommended. If you've had blood clots, deep vein thrombosis, or a stroke, hormone therapy could increase your risk of another event. If you have active liver disease or unexplained vaginal bleeding, those are also contraindications. And if you're at very high risk for cardiovascular disease, your doctor will need to weigh whether the benefits justify any potential increase in risk. What most people miss is that hormone therapy isn't one thing. There are different forms of estrogen, different types of progestins or progesterone, different doses and different delivery methods. Pills, patches, gels, creams, vaginal rings. These aren't interchangeable. Transdermal estrogen, meaning a patch or gel, may have a lower risk of blood clots compared to oral estrogen. Micronized progesterone may have a different risk profile than older synthetic progestins. So when we talk about hormone therapy, we're really talking about a whole menu of options that can be tailored to an individual woman's needs and risk factors. This is why the FDA's decision to remove the black box warning is so important. That warning treated all hormone therapy as equally dangerous, which isn't accurate, and it scared women and doctors away from even having the conversation. With the warning gone, and with updated labeling that provides better context, the hope is that doctors and patients can actually discuss the risks and benefits in a nuanced way, rather than just shutting the door based on fear. Where do you see yourself in this picture? Are you in that window of opportunity, dealing with symptoms that are affecting your quality of life, wondering if there's something that could help? Or are you past that window, but still dealing with issues like vaginal dryness or bone health concerns, and wondering if there are safe options for you? These are the questions worth bringing to a healthcare provider who understands menopause and hormone therapy, not just someone who's going to reflexively say no because of outdated information. So what does all of this really mean for you if you're over 40 and navigating perimenopause or menopause right now? It means that a conversation that was shut down for more than 20 years is finally opening back up. And that's a good thing. Not because hormone therapy is right for everyone, but because women deserve to have accurate information and real options, not just fear and dismissal. Here's the practical takeaway. If you're experiencing symptoms that are affecting your quality of life, hot flashes, night sweats, brain fog, mood changes, pain during sex, and you're within that window of opportunity, meaning you're under 60 or within 10 years of your last period, it's worth having a conversation with a healthcare provider who is knowledgeable about menopause. Not every doctor is. Unfortunately, menopause education in medical schools has been severely lacking. But there are specialists, gynecologists, endocrinologists, and menopause-certified practitioners who understand the current evidence and can help you weigh your individual risks and benefits. Come to that conversation prepared. Know your own health history.
Have you had blood clots? Do you have a family history of breast cancer or heart disease? Are you a smoker? These factors matter. And be clear about what you're hoping to achieve. Are you mostly looking for symptom relief? Are you concerned about bone health? Are you interested in potential long-term benefits? Or are you just trying to get through the next few years without losing your mind? These are all valid goals, and they'll help guide the conversation. If your doctor says no to hormone therapy without really explaining why, or if they cite that old 2002 study as the only reason, it's okay to ask more questions. What about my specific situation makes you think the risks outweigh the benefits? Have you seen the updated guidelines from organizations like the North American Menopause Society? Are there different forms or doses we could consider? And if you're not getting answers that make sense, it's okay to seek a second opinion from someone who specializes in menopause care. On the other hand, if hormone therapy isn't right for you, either because of contraindications or personal preference, know that there are other options. Lifestyle changes, exercise, stress management, sleep hygiene, and dietary adjustments can all help with symptoms to varying degrees. There are non-hormonal medications that have been approved for hot flashes. And for vaginal dryness and discomfort, there are low-dose vaginal estrogen products that work locally and don't carry the same systemic risks as oral or transdermal hormone therapy. The point is, you don't have to just suffer in silence. What this FDA decision really represents is a shift in how we think about women's health at midlife. For too long, menopause was treated as something trivial, something women were just supposed to endure quietly. Or it was medicalized in a paternalistic way, with doctors making decisions without really listening to what women were experiencing. This new approach is about shared decision-making. It's about recognizing that menopause is a major physiological transition that can have a profound impact on quality of life, and that women deserve evidence-based options and respectful, informed conversations. The FDA commissioner called what happened an American tragedy, and he's not wrong. 50 to 70 million women over the last 2 decades were denied access to a treatment that could have helped them based on fear and misinformation. That's a staggering number. And while we can't undo that harm, we can learn from it. We can do better going forward. We can make sure that the next generation of women going through menopause has access to accurate information, compassionate care, and real choices. One more important reminder. Everything we've talked about in this video is general educational information. It's not personal medical advice. Every woman's situation is different, and decisions about hormone therapy or any other treatment need to be made in consultation with a qualified healthcare provider who knows your individual health history and risk factors. This is about giving you the knowledge to advocate for yourself and ask the right questions, not about telling you what to do. If this video gave you some clarity, or if it raised questions you want to explore further, we have other videos on topics like bone health after 40, navigating perimenopause symptoms, and how to have better conversations with your doctor. Real information, no hype, just practical guidance for living well in your 40s, 50s, 60s, and beyond. Because health span matters, and you deserve to feel good in your own body no matter what stage of life you're in. Comfort, not cure. That's the goal. And with better information, you're one step closer to getting there.